it feels unfair as well, seeing lots and lots of people experiencing this pandemic, and we're in this kind of lull of security, I suppose. Lucky, but at the same time, we could very easily be in that situation too if we made the wrong decision. You know what I mean? Hi, I'm Ange. I live in Wellington, New Zealand. I am 34 years old and I work as a doctor at Wellington Hospital. At the moment, it seems like we are COVID free because we haven't opened our borders, and all of our cases that are positive for COVID are all kind of contained and in the quarantine. Our lives have been completely disrupted by this, by COVID. We've made plans, or people are supposed to sit exams, or do training, or have plans to go overseas to do an OE or whatever. A lot of things have been affected by it, and our personal lives have been kind of turned around in various ways that we've never really expected, and without much end in sight. Like, I'm supposed to have a wedding in September this year. Friends from Germany, Singapore, Australia. My partner's Brazilian, so family members from Brazil were supposed to come, so none of them are coming. I think we'll just have a wedding now with my immediate family and our close friends, and later on, we'll think of something else, like we could visit them, or they can visit us, or we'll have a big party again at some point. It sucks, to be honest, but it is what it is, and we just have to kind of be positive about it, really. We did a pretty serious lockdown. It was like a 6-week period of level 4. You just stay at home, just essential workers only, like supermarkets and hospital, and, even schools had to do schools at home. And the outcome of that is that we really flattened the curve of the COVID pandemic. And to be honest, we saw some cases, but not a lot, and we didn't have that many deaths. We had 4 different types of levels. So, there'll be just normal, like where we are now, which is level 0, and that's where there's no restrictions whatsoever. And then there's level 4, and level 4 is the most stringent of them all, where you have to have social distancing, 2 meters between each person. You have to wait in front of the supermarket. It's all very, very, very strict. I know a lot of people were very anxious. Supermarket trips is quite difficult. On paper, it's easy to say that you need to keep your distance, but when people are in the supermarket and worried about their lives, they don't really care, and they just come close to you, and everyone's quite aggressive. This was in one of the biggest supermarkets in New Zealand anyway, and I remember that being quite an experience. And I'm not usually an anxious person, but that specific day I was like, man, this isn't fun. But in terms of the day-to-day life itself, it's bizarre. It's very bizarre. There's no cars, it's quiet, but at the same time, there were lots of people just being outside. They were just, because you're allowed to walk, get out of the house and enjoy the sun as long as you keep within your bubble. So there were a lot of people that were just exercising and enjoying themselves within reason, I suppose, but a lot more than when it wasn't the lockdown. So maybe people were just going stir crazy, just being at home. It sucked that we couldn't go to the gym because the gym was closed for 6 weeks, and I normally go to the gym quite frequently, so had to do exercises at home or outside. Bit of a change, different, but I enjoyed it actually. Food-wise, the things that were really missing a lot in New Zealand was flour. We ran out of flour in the supermarket. People would just buy kgs of flour. Oh, and toilet paper, yes. At one point, yes. But Jacinda was like, Please don't worry, there will be food for everybody, including toilet paper. This is in the radio announcement. She's like, please don't panic buy. There will be food for everybody, and there will be toilet paper for everybody. So please be kind to each other. Like, that was what she said. So that was really nice. It was really nice that she reiterated that, actually. When they knew that the pandemic was coming, they did do a big countrywide planning, basically, between the government and the health official, the public health official, and that's how they kind of decided. And I think my understanding is that they would have based that on previous studies and methods that other countries have used to kind of assimilate, one that would work for us. I think Jacinda, she did a really good campaign and educated young people and adults as well through kind of social media and like the news and things like that, and she'd make these really kind of relatable videos about what COVID is, and would talk about COVID and get kind of social communicators to explain what it is and how it's transmitted and like what are the bad things or what are the side effects of COVID and how it could, I suppose, manifest in people. And so she did a lot of that, and there's everywhere. It was on Instagram and Facebook, and I think she really kind of got to a lot of people. And she didn't make this decision kind of lightly, I suppose, and she did communicate it. Those midday meetings, at lunchtime, she would say what she thinks and where she thinks we need to go next. That really got a lot of our attention, and she answered a lot of the questions. So like the media would ask her questions, newspapers and just people even, they would ask her questions and she would answer them there and then in a really relatable way. And I remembered because during the lockdown I was still working when everyone else was staying at home or working from home. But I could remember like driving to work that there would be like this notification saying, this is a COVID-19 notification, just to remind you all that this is a difficult time, but we all need to keep within our bubble and wash your hands and da 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 da. I certainly feel like I was supported in what in what we did, and it's a big undertaking, and I think that's part of the management of a pandemic is leadership. New Zealand has the advantage of being at the bottom of the world with an ocean surrounding it. And we're a very small nation country as well, like 5 million people. And everyone that comes into the country at the moment, they have to be quarantined and you have to be tested when you get in there so they know what your status is. But it's a mandatory quarantine. It's a 14-day quarantine in a hotel or some kind of living facility around New Zealand. And we don't allow any tourists or any foreigners to come into New Zealand. I guess there will be some cases where people just won't comply and they would, escape from the quarantine. And, if that's the case, then they can very easily lead to community transmission. The New Zealand populations is kind of a bit divided. In the one regard, you want to be safe, and in the other regard, you're aware that the economy's not as good as it could be. In New Zealand, they've laid off a lot of people, a lot. And their share prices dropped by, gosh, I don't know how much. It was like a third of their original price. And it hasn't picked up since yet. And lots of people still unemployed from that layoff. People are not going away to go on holidays, and people are traveling domestically, which is good for the economy, but I don't know if that's enough. People or more conservative Kiwis are starting to worry about the economy and what the impact it would be. They worry about the future. As I said, how long this lockdown is going to be and how long this we're going to close the border for, and what would that mean for the impact. And as you know as well, our lockdown had cost us a lot of money and put us into debt. During the pandemic, Jacinda did give out some money for people that have been affected by COVID, have lost their jobs and have a family to feed. So she puts money into their account to make sure that they can live. And I think there's two schools of thoughts, and I can see why people think that. I can. And I think you can too. On the one hand, we want to keep people safe and comfortable, but on the other hand, we have this huge amount of debt, like 19 billion or something, and how are we going to ever pay that back when the economy is not as good as it could be? And that is a concern. Part of that would be, I can tell you, is increasing the tax of our day-to-day income, and that would mean that we would save less and all that kind of stuff. And I think people that earn a bit more would experience that a bit more. It's difficult when you have a big debt like that and thinking about how you're going to offset it and where to from here. I mean, I can see why that would be difficult, but you have to kind of balance that with the safety of the people. I mean, I know that Ashley Blomfield and Jacinda would have made the right decision in the setting, and I think they have. And I think we will be in a very different position if they didn't make the decisions that they did. And a lot more people could have lost a lot more jobs. I mean, I don't know, a lot of people that have not completely locked down, they've just partially locked down. They're getting really huge surges now, and they have to, repeat level 4 lockdown. For example, in Melbourne, they only did a level 3, and I think it wasn't enough, and so they had a really big surge, and now they have to be in level 4, and I think it could have been a waste of time. I mean, I don't know. I think it's just very unfortunate that a lot of the male leaders haven't shown great leadership in this setting that we know of. I don't know if that's a gender thing or it's just the way they view the world. They may just put the economy as a priority more so than the female leaders. And I like to not be sexist, and I don't want to say that there is a difference in the way people lead because of their sex, but I think the difference is probably from the way they perceive the world. And it just so happened that it's different, and they put different priorities on different things, and as a result, the outcome is very different for different countries. We follow Brazil quite closely. Raf's family's from Brazil. He's very worried about his family because the virus is coming closer and closer. He's from the south of Brazil and in a small town, and for a long time it was all in the big cities, but now things are kind of coming closer, and we have family members that actually are positive for COVID in Brazil, and Raf's very worried that he won't be able to see his grandma again. We don't know when he can see his parents, his sister, when we can actually travel safely. I actually haven't been to Brazil as well. So I guess those are questions that's running on our minds, but it feels unfair as well, seeing lots and lots of people experiencing this pandemic, and we're in this kind of lull of security, I suppose. Lucky, but at the same time, we could very easily be in that situation too if we made the wrong decision. I think Jacinda's just very sensible, and she's motherly, and she's a good orator. To be fair though, our health minister, Ashley Bloomfield, he's a male and he's done a fantastic job. He worked together with Jacinda, and he advised her about what he thinks she should do or the country should do in the setting of a pandemic like this. And everybody praises him, and I wouldn't be surprised if he got the New Zealander of the Year award this year, because he's just shown so much leadership with like humanity and like humility, and I think we are where we are today mainly because of his leadership as well. I'm a medical registrar, so I'm training in internal medicine. Life is not much different for me because I go to work every day. But it was very different from my partner, who was at home every day. He's a software developer. He just had a computer and was working from home, and he still is working from home 3 days a week, even after the lockdown. But life is just the same for me. The hospital was very quiet, like very, very quiet. I think people were scared to come into hospital because they think it's a highly contaminated area. Coming from like an internal medicine point of view, people that we manage are people with chronic illnesses. So a lot of them would just sit at home, and if they are ill, they would just sit at home and wait and wait and wait. And by the time they come into hospital, they were already sick. So there were a lot of that. By week 3, week 4, there were a lot of those kind of patients. Our hospital had to go through a whole bunch of restructuring because after the lockdown, they were all worried that, there was going to be a big wave of COVID positive patients. They made sure that the services that were present were just the ones that are necessary. So the acutes, any elective operations and everything, they cancelled or they postponed to another day. The whole hospital was restructured only for 3 weeks, and then after that it went back to normal because we just didn't have any cases. We've de-escalated a lot. And only people that we think may have the potential to have COVID would get a swab, but not everyone, and certainly not like the way we were swabbing people when, during the lockdown, where just like a sniffle, you'll get a swab. Anyway, so I was working in the COVID team. We have like a little ED, like a little emergency clinic, specifically for COVID patients or to see patients that show signs of respiratory illnesses and fevers. So they don't necessarily have to be COVID, but they have to present with similar symptoms. So the one I saw was in his 30s and an Uber driver as well. He picked up passengers from the airport, and that's how he got it. And the GP called me to say that she's done an X-ray of this person, and she's really worried that this person is showing signs of COVID. So she sent him to my clinic, and indeed, he had all the symptoms of it, and his swab was positive for COVID. So he ended up being taken into hospital for observation, but he remained well. So he went home the next day. And little that we know, he lived with his wife as well, who's pregnant, and he's also got a daughter. So from the public health point of view, it was felt that he was, the whole family is a probable case. The wife and the daughter probably will have the case as well. And so the wife came in the next day because she was unwell. So I think those were kind of, that was the specific case that I could remember. We had to go through formal training. It's basically you wash your hands, and you make sure you wash it until like your elbow, like that, and then you put your gloves, and then you put your gown, and there's a special way to put it on, so that's called donning. Then once you've done that, you put your hair thing on, and then once you've done that, you have to put your mask. And the mask that we use at the hospital has a visor on them, so it's like a thing like that, and it's got like a clear plastic visor. So you just put that on, and then before you go into the room, somebody has to check that you've put your PPEs on properly. So they will, they'll kind of give you an okay that you've done that. And then you go into a double room. So it's like a negative pressure room. So 2 doors. You often put your equipment on in the first room. So you call that donning. So you don your PPE, and then you enter the room that the patient is in, because they're in a single room with like a negative pressure air. they have a camera, so like the nurses can see what you're doing and how you're doing, and only one person at a time can be in that room. And then you talk to them and you use the equipment that's in the room specifically for them. And when you're done, you have to take it off. But you have to take it off in a really special way as well. Like, so you got to carefully take your mask off, take your hairnet off, and then you have to doff your PPE, and you kind of doff it like, like this. You kind of pull them and you roll them as if they have like pepper on your apron. You have to really slowly do it, and then you roll it into a ball and you let it fall into the rubbish bin. And then after that, you pull out your gloves and you let that fall into the rubbish bin as well. It's a process. It takes 15 minutes to put it on. I never feel like, that I need to be appreciated for my job, but I hope that they do. I remembered when we were kind of planning for this, my boss was saying that, you guys have been chosen to be in the COVID team because you are young and you are fit and well, and that you were the best trained for this job compared to, your older colleagues or your junior ones. So how do you feel about being in the COVID team? And obviously you can say no if you don't want to. That's what my boss said. But you kind of have this like sense of responsibility, like I have to do it. Like I remembered feeling really quite scared before my first shift in the COVID team, because I knew that if I got sick, like my partner Raf will get sick as well, and it will be the both of us experiencing this together. And my parents would worry, his parents would worry. But after that initial panic, I kind of just, accepted it and was like, well, this is my job and this is what I trained for, and it's my responsibility to fill these shoes, so I'm going to do it. And so that was it. In the acute setting, when the pandemic was starting, the 6-week lockdown period seemed to work, and it was the right thing to do. But like now that we know what it looks like, what next? If COVID's going to be around for another 2 to 3 or 4 years, which it could be, we don't know that. What would it look like? And I don't think we can close our borders forever as well. I don't think that's the right thing to do. Now it's like a sense of security that it was something that we've already passed. But the second wave could come any minute, and it could be worse. And if we do have a second wave, we would struggle. Depending on how large the wave will be, I don't know if we have the infrastructure to manage them all. I don't think we have enough ICU facilities, for example, or ventilator support to contain a lot of people. Yeah, or thousands and thousands of people. Like, I don't think we have that. And would you actually want to try a vaccine that's just been developed, that you don't really know the potential side effects of, and no one's really used before? Would you actually really want to try it? I think people have to be creative about creating solutions solutions to improve the economy, I suppose, without having to jeopardize people's safety and without having to do much travel while we're in this period of time. And I don't know how we can do that. And I think you can always see the glass is half full or half empty. But if you look at it as a glass half full, that's an opportunity. But in terms of a negative consequence, I mean, lots of things. You could lose loved ones. A lot of people have lost loved ones. They would have lost their jobs. The number of people that went into depression because of COVID. The number of people that have lost their businesses, their careers, their life direction, their plans. I think people are a lot more kinder and more understanding of each other, after this event. It kind of unites everyone because we're all experiencing it together, even though we live in different continents. I think that's a really important experience. And specifically for me, I would have had an experience working in a pandemic. You know, in my short career as a doctor, I've experienced working through a pandemic, and I think that's a positive. That's a positive for me.